Benjamin Franklin once said, "Early to bed and early to rise makes a man healthy, wealthy, and wise." And Thomas Dekker once observed that sleep is the golden chain that ties our health and our bodies together. It's estimated that for some 70 million Americans, getting a good night's sleep is easier said than done. Things like snoring and sleep apnea can leave these people and their bed partners feeling tired all day long. Now, you may have heard of a CPAP machine helping people with sleep issues, but how about a didgeridoo? Take a look at how Dr. Gensimer and his team are helping people get back to the restorative sleep they need.
Common symptoms that people with sleep symptoms might notice would be snoring loudly at nighttime, sometimes waking themselves up, waking their bed partners up. They may also have leg jerks or kicking of the legs when they sleep. They would probably notice that they're maybe tired or sleepy during the daytime. They may notice just fatigue also. They may have trouble getting to sleep or staying asleep, and sometimes they wake up early and can't go back to sleep. Narcolepsy is another one where there's an uncontrollable tendency to fall asleep during the daytime in spite of getting a very good night's sleep the night before. Probably 70 million Americans or so have sleep disorders, insomnia being the most common, followed by obstructive sleep apnea, restless leg syndrome, and narcolepsy. One of the key things about Northwind Clinic here is that we're a comprehensive clinic. We treat a wide range of sleep disorders, but we also see a wide variety of patients with lung problems, which can range from shortness of breath to asthma to emphysema to abnormal chest x-rays. We have a professional caring staff. We provide comprehensive care. Our sleep studies and the sleep follow-ups are done at a little lower cost than at the hospital labs. But I think the main emphasis is that it's personalized care designed to meet the needs of each patient, which are always unique. If someone comes in with symptoms that they're concerned about their sleep, or it's their bed partner or someone else is concerned about it, the usual process here at Northwind is that they would come in and have a consultation where we take a history and do a physical examination, determine an assessment, and then recommend evaluation. And that might well include a sleep study, in which case they would come in to the sleep center here and get hooked up for an overnight sleep study in the lab, in which they stay overnight and have monitoring of multiple different channels of data collection. Then that would follow up with, if they need equipment, we can set up the equipment and get that going for them, and we do close follow-up with that to ensure that they're successful with using it. And we also work with people who don't want to use CPAP or can't, looking at alternative treatments with either a dentist doing a mandibular repositioning device, and we have a couple of patients that are playing the didgeridoo as an alternative treatment for these other things for treating their sleep apnea. I think the thing that surprises a lot of people about sleep apnea, if they have it, is that once they get treated, that they feel so much better than they did before. They also get feedback from their bed partner that their bed partner is sleeping much better than they were before the person was using, or before they were treating their sleep apnea. A typical day for me would include coming in about 7 in the morning and checking in with the sleep techs to review the studies from the sleep patients that were there the night before, along with Julie Dahl, the nurse practitioner, going and talking to these patients and giving them the results of their sleep study. You would find me doing some interpretations on the sleep studies, and then having clinic hours where I will be seeing new patients and follow-up patients for both sleep and pulmonary problems. Things that constitute a good night's sleep would be keeping a regular sleep-wake schedule so that you're going to sleep at roughly the same time each night. Ideally, you would sleep through the night without a lot of external disturbances, either in the home or outside the home, and you would wake up without an alarm clock. People who wake up using an alarm clock are probably somewhat sleep deprived because they've awakened themselves with the alarm clock before they would normally have been done sleeping. Things that people can do on their own to ensure a better night's sleep would include things like keeping a regular sleep schedule, avoiding use of alcohol and caffeine, in the evening, several hours before bedtime, having a relaxing wind-down routine that half hour to an hour before bedtime, and then allowing enough time for them to get the amount of sleep that they need each night. Everyone needs a little bit different amount of sleep. The average is 7.5 to 8 hours a night, but some people only need 6, and some people need 9 or more hours a night. And so part of it's understanding what you need in order to achieve that adequate sleep. Well, I find a number of rewarding things for this job, but one of the most rewarding things I think is with the sleep patients that are sleepy during the daytime or fatigued and tired, come back in after successful treatment and report that they're feeling so much better than what they did before. That's been a really rewarding feedback and experience to work with that.